testing?
Okay, so like I said, I had a call with the volunteer center for the Department of Health, the local Department of Health, the day before. They offer you, the testing schedule, the location, and you pick a time that works for you, and they tell you to arrive, 10, 15 minutes before your scheduled time so that you're already in queue at the time that your scheduled appointment is supposed to happen.
Okay.
So for me, I picked Easter Sunday the next day because I figured it would be lower volume with people worshiping the Lord at
Hello.
home. There was still a good number of people, but it was a steady flow in the line. And you basically drive up to the area. There are cops scattered all throughout the route in their vehicles, some standing outside of their vehicles and directing traffic and instructing people to really follow each other closely. From there, you see military personnel circulating around the area in and out of a tent and addressing people in their cars to kind of get them verified, checked in, so to speak, and then pushed through.
Were they dressed in full full mask, full shields?
They had the regular little masks on, not even N95s.
Okay.
Some of them, like the little blue ones you see
Yep.
everybody with. So I was kind of surprised at that, but at the same rate, they were not allowing anybody to put their windows down through the process.
You had to put your license on the screen.
Yep.
I mean, on the window.
Put your license on the window. They confirm your last name. They would radio or holler to the tent to verify that you had an appointment and that you're there for that time frame that you're supposed to be.
Okay.
So then from there, you're funneled around this route that they've blocked off in the parking lot. You're then instructed again to keep your windows up and answer the questions that are asked of you once you get into the tent. As you're approaching the tent, you'll see, the personnel dressed in hazmat from head to toe to protect themselves. And there's another military personnel in there to, again, verify your information. So you're verifying your information 50 times over. Keep your driver's license out. The verification number they gave you when you requested the testing, didn't even need it. So then from there, once they tell you to put the window down, they give you a little spiel and hand you discharge instructions. Then they tell you to tip your head back so that they can see your nostrils. From there, they're going to inform you that they're going to be inserting this pretty long Q-tip all the way in. They say it might be uncomfortable, but try to hold still. For some of you that have sinus issues, allergies, inflammation in your nasal passages, normally it's probably going to be extremely uncomfortable. They put it in till it don't go no more. Okay.
Oh, touch the back of the brain, child. Whew.
Yes, you almost feel it in your throat. And then it stays in there for a few seconds to marinate, and then they pull it out, which is going to give you a natural reaction. Your eyes are probably going to tear. When they do it, if you move too much or contract too much, they're probably going to have to do your other nostril. So
sit still, people, and don't move. Otherwise, you got to do that twice.
Yeah. It's not comfortable, but for me personally, it wasn't traumatic.
Okay.
From there, you roll up the window, you roll out. That's it. On your instructions, there's general instructions about safety if you think you've been exposed with the whole quarantine concept and so on, and hygiene. But beyond that, it gave me a website which they expressed I would be able to see my results on within 48 to 72 hours. From there, I checked the website at the 48-hour mark. And at this time too, I want to say 2 days after the test, I started to feel like I was starting to fall under the weather.
But at that point of the test, you were okay. You were just feeling okay. You were feeling fine, and you just
yes. Yeah. After the test, 2 days after the test, I started to feel like my throat was scratchy. I had a slight runny nose, and I started to get a burning sensation in my chest, in my airway. Not my upper, but my lower respiratory.
So did that feel like the same issues that you had in the weeks prior?
I didn't really notice much respiratory discomfort except for one night in the weeks prior, where I literally had aching along my my trachea, along my airway and my bronchioles. It was a painful cough for that day as well. And almost a sensation of pressure when I laid down flat. That was alleviated when I got up.
Wow.
That was only for one night. And then it just went away. But this was like a constant sensation of burning, almost like if you just took a run out in the cold and you have that burning sensation along your whole like airway, you know what I mean, in your chest and stuff, but very mildly.
Okay.
That persisted and still persists, and actually got a little bit worse over the last week, with an occasional cough, especially if I've been active doing stuff for a while. And not even talking exercise, like housework, up on my feet, walking around up and down the steps, moving things, not even heavy. But I would then notice tightness, pressure, a little increase in my breathing rate during those times that you really can't do nothing for but rest.
Yeah.
I did notice that after a hot bath, that sensation alleviated. So I do think that some of the discomfort is muscular. Because for one, when you're sick and you're inactive, your lung expansion is going to be reduced anyway because there's no reason to breathe heavily.
Yeah.
And for those people that are having a lot of breathing difficulty with the COVID, you have to consider when you lay on your back, which is like the worst thing you could do in the instances that you have potential to develop pneumonia, fluid can pool in the lungs more easily. Beyond that, it puts your diaphragm at a disadvantage from a mechanical standpoint.
Okay.
And how you are able to generate the best contraction in that muscle.
Mm-hmm.
So you're not aerating as well. You're not because people sometimes have pain with this condition with their breathing, the amount of expansion that they're willing to allow, meaning like taking deep breaths, is limited. So that means that your lungs are only working in a limited range of motion, your rib cage only working in a limited range of motion for a set amount of time. Then you go to try to pick up your activity, and which calls on more lung expansion, more oxygen intake, flexibility in your thoracic and your rib cage that just isn't really available yet.
Oh.
So then you start getting short of breath. So I think that that's what my issue has been with. It's just like you went from nothing every day to trying to be a busy bee and get stuff done, and my body just isn't quite caught up with that yet.
Okay, so do you think for people who are self-quarantining now, like how important, as someone who's dealing with this now and just because of your PT expertise, how important is it for us to stay active during this time?
You should stay active so that you are comfortably increasing your respiratory rate and your heart rate. Heavy, intense exercise is not what you do when you feel ill.
Right.
Period.
Yeah, no.
Because your body's probably going to relapse and your system is not quite ready to tolerate that level of cardiovascular demand and oxygen deprivation. Remaining sedentary, especially laying down, needs to be varied if you don't feel like you can be up and about. So that means you need to prop yourself up on several pillows or sit fully upright, lay on a different side. To an actual position for lung drainage is on your stomach.
Okay.
And you can place pillowing underneath you in different places to pitch you in one direction or another as well, to kind of bias towards one side of your lungs or the other's, one lobe versus the other.
Okay.
So laying on the stomach is actually a position that they may employ even sometimes in the ICUs to help with natural drainage of fluid out of the lungs. So laying on your back is the worst you could do if you're having breathing difficulty. And getting your head elevated is better because it puts your diaphragm at a better mechanical advantage.
Okay, gotcha.
So if you got to be down because you can't tolerate the activity, vary your position and spend time upright. Spend time physically out the bed in a chair, just because all of that calls on a different level of demand on your muscles of posture and your muscles of respiration. And then it'll help to kind of progress your endurance for activity very, very gently and very gradually.
Gotcha. Like every morning I get up and I take like really deep breaths just to make sure I can have that like expansion of my lungs like you mentioned. And sometimes I'll try to do it like when I'm taking a hot shower just because my muscles are more relaxed to see how deep I can breathe. Just because like I'm really worried, like I want to be able to notice like if my lung capacity is not functioning where it should be.
There was a particular test that was being discussed for looking to see if you had any compromise with your lung capacity amidst this COVID crisis, and that involved first thing in the morning taking the deepest breath you can take and then holding it for 10 seconds.
Okay.
If you can do that without coughing or without pain.
Okay.
And that was an indication that your lung function was probably going pretty well. I also saw another exercise activity demonstrated by some medical professionals that involved you taking a series of 5, sorry, I have an eyelash or something, a series of 5 deep breaths. Hold each breath for 5 to 10 seconds.
Okay.
Then on the 6th repetition, you would take a deep breath and cough forcefully versus hold your breath. This is to help clear the lungs, basically.
Okay.
With regards to the deep breaths, it's important, again, because you're maintaining your lung capacity. You're maintaining the extensibility of the lung tissue. You're maintaining the movement of the rib cage to accommodate the expanding lungs. So it's helpful. Stretching your upper and middle back, like doing like cat and camel poses.
Yeah.
Chest openers.
Okay.
Are also very good for just getting that thoracic expansion.
Gotcha. Thank you, Miss Sonia.
Yeah.
You know, all the saving lives on the FaceTime.
Baby.
Per usual. Do you have any other gems, like final gems that you want to drop on everyone about the process with COVID? What to kind of like, I don't know, like...
My rule of thumb for this whole thing is that everyone is infected until proven otherwise, period. Because the opportunity for exposure exists for every single one of us. When they've described and talked about flattening the curve, that just means that we are going to slow down the number of positive cases right now. It does not mean that the virus is gone. The virus isn't going anywhere, at least for the duration of the year. But our medical healthcare system cannot handle everyone getting sick at once. Right. Social distancing, quarantining. You all will still get sick if you're going to, once things open back up. But hopefully at that point in time, the system, the healthcare system, is at a level of function where they can manage. Some of the losses of life in other countries, not as much this one, but still, if you talk to nurses in the ER and so on, it is a lack of medical personnel to negotiate that many critically ill patients at once. This is why it's important to stay home. This is why it's important to socially distance. One thing that, I've observed and I've seen and I've heard talked about, people post about it, going back and forth between different households. You have kids that have, co-parenting situations. You have family members that live in different areas. You stick to your household and your household only, because every time you leave your house, you could be exposed. Every time you go into someone else's home, you could be exposing them, or vice versa. If someone has been ill, it's a good idea to clear them or to stay clear of them for at least 14 days. But again, that 14 days rule of thumb is obsolete, because I was exposed almost 40 days ago, if we do the math.
Yeah.
And I tested positive just a week and a half ago.
Wow.
So you could have an alleviation of symptoms and still be positive for COVID and not determined if I'm still contagious or not. We don't know. I could still be contagious. You have people who are under that umbrella of belief that because no one is having symptoms, themselves and the people around them, that none of us has active infectious COVID, and that is wrong.
Right.
So, and that's the part about the mask wearing where they talk about it's to protect other people. And that is very true. They say, because you've heard a lot of talk about, the mask doesn't even keep you from getting it, blah, 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 blah. It's not about you.
Yeah.
It's not all about you. It's about containing the infection as a whole, as a collective. We all have to do our part. That's why we're wearing these masks.
So how do you, I guess, what's your opinion or thought process around, they said you have to have the N95. Then they're like, get a different mask. Then they're like, damn it, just wear a bandana or whatever you can find. So like, some people are saying, I've heard opinions that it's just like, well, if I don't need N95, then this thing is going to do nothing. So I'm just going to wear nothing.
The thing about the N95, again, is it has a higher known filtration rate, meaning it's going to block a lot of particles from passing in or out of that mask more than any other.
Right.
That becomes very important for our medical professionals because they are in close proximity with the infection over consistent amounts of time.
Right.
If you're just passing through the store and you're really not up on top of people for long periods of time, your opportunity for exposure is a lot less.
Right.
And so the thought process is everyday grocery runs, you don't need this. You don't need something at that high level of filtration because of the lack of proximity and chance of exposure.
Mm-hmm.
But you should have something to capture droplets, let's say if someone else is in your vicinity not wearing anything.
Right. Okay, that makes sense. Mm-hmm.
So that's why they're not pushing for people to have these for their everyday use, because for one, there's a shortage for the people that actually really need them, which is your medical professionals who are 100% exposed for long periods of time every single day.
Mm-hmm.
So those standard little paper masks, a bandana, a coffee filter, whatever you're doing is better than nothing to protect you, to a degree, but also to protect others. Again, you are a carrier potentially until you have tested negative for COVID. If you have not taken a test, you cannot say out your mouth that you're fine. Bottom line.
Wow. That's real.
A big misconception. And then when you have households with multiple people, yeah, we're all in the same house. Yeah, we're family. We share DNA. COVID doesn't care. There's stories in the news about families that had dinner, gatherings, celebrations, birthday parties in the weeks that this was starting up, and 3, 4, 5 family members end up with corona. Some of them didn't make it. So germs are germs, yes, within your household, and you're probably all sharing them, but you still have a duty to each other even to remain cautious.
Right.
So everyone is at risk of exposure.
Everyone. It doesn't matter. Corona is one virus that does not care your age, your race, your sexual orientation, your demographics. It just does not care.
Doesn't care. It doesn't care. And that's the misconception with many of, people our age and younger is, I'm fine, I'm healthy, I'm blah, blah. It's not about you. You can go visit your mom, your dad, a neighbor, whoever who has other comorbidities, diabetes, high blood pressure, obesity, asthma, all these kind of things predispose people to potentially having more severe reactions to the virus.
Yeah.
And it doesn't matter your relationship. It doesn't matter. You gotta think about cutting down on cross contamination if you can, so to speak.
Facts.
So if this is where you at, this is where you stay. There's considerations that have to be made.
It's true though. People have to think about that. It's hard for us. It's hard for our families. It's hard for kids and old people and young people. Like, it's just hard for everyone to adjust right now. But I think you have given us so much insight and knowledge, and especially being like, yo, I was sick, I was fine, and I'm still positive. Do I know if I'm, contagious or not? Like, that's a big deal. And I think a lot of people don't see real world people like us who look like us talking about it. So I just thank you so much for your time and letting me interview you and sharing your stories. It's always a pleasure to talk to you.
Likewise, my dear.
Yes. All right, so I will catch you next time on FaceTime Facials with the Fab Nerd.